I am Miranda, and today I have our guest, Jacqueline Ringo from Community Action Council. And this show, we talk all about your rights. So today we're going to focus on what are your rights to access health coverage. And Jacqueline has a lot of experience with this topic. I've known Jacqueline for several years as a kynector, an application assister, and again, a kynector for helping people sign up for health insurance in Kentucky. And so I'm really excited about getting to talk about this topic. It's a really timely topic right now during open enrollment. And just so you know, if you're tuning in online or on the radio, we are recording this on November 17th, 2020. And so all the information is of that date. So thanks for joining me, Jacqueline.
Well, thanks for having me, Miranda. I appreciate it.
Yeah, so can you just start off a little bit by talking about, Community Action Council and what you do there?
Well, as you know, Community Action, of course, is all across the state and as well as the nation. And I work for Community Action Council, which covers Fayette, Bourbon, Harrison, and Nicholas counties. And we do have kynectors in each one of those counties. And what we do is basically, in a nutshell, is we help individuals and families to obtain and maintain affordable health insurance.
Yeah, thank you for joining us. And I'm also a kynector, and that is how we met, was being at events together, helping people enroll and letting people know what their rights were to get health coverage. So now, like I said, is a really important time period. It's open enrollment.
Yes.
So what are we talking about when we say open enrollment?
Well, open enrollment begins each year, November 1st, and lasts through December 15th. During that time, anyone that currently does not have health insurance or they want to change their health insurance, that is the time to do that. The government has assigned that time for open enrollment for people to do just that, to get signed up for health insurance. If you qualify for Medicaid benefits, of course, you can do that at any time during the year. But if you want to change your insurance company, or if you need to sign up for health insurance because maybe you lost it maybe you no longer qualify for Medicaid, or you lost job insurance, then now is the time to do that. And the clock is ticking, and so the end of that open enrollment will be here before we know it.
Yeah, and I do want to point out too that if you're like Jacqueline's talking about, trying to get health coverage on the marketplace, which is healthcare.gov, then your deadline is December 15th, unless you meet some special criteria, but for most people. And then if you have Medicaid and you want to switch from one company to the other within your Medicaid, you also have until December 15th this year.
Yes.
And then some people listening, you might have Medicare, which is an entirely different program.
Yes.
And it also has an open enrollment period that ends on December 7th.
Okay.
So,
that's true.
Different periods.
And can I just inject this, is that a good way to keep them separate, Medicaid and Medicare, is that Medicaid is aid. It's financial aid. So it's based on your income, and of course some other things, but mainly it's based on your income. Medicare is what you qualify for at a certain age, like 65, or if you have a disability, then you may qualify for Medicare. So it's about care. So that's a good way to kind of differentiate between the two.
Thank you. I know people get them confused all the time.
Yeah, they do. Yeah.
So I do also want to point out that if you do have to go to healthcare.gov, there is financial assistance available. So how can people enroll in the marketplace?
Well, like you just said, you can go to healthcare.gov yourself. If you're not used to doing online applications or understanding the online language, then you can also contact a kynector to help you with that as well. We do help with the applications on healthcare.gov. So all you have to do is to contact Community Action Council. That number is 859-233-4600. And you just ask to speak to a kynector in your county, in the county in which you live, and they will transfer you to that person, and you can speak with them and they can help you. We are doing helping or assisting with applications over the phone right now because we're not doing in-person applications. So we still can help you over the phone We can communicate through email or our phone to get documents that may need to be uploaded or whatever. But we will help you all the way through the application and help you get the coverage that you need.
Awesome. And so I'll add to that that Community Action Council is one of several locations where you can get help. And so there are some health clinics also that provide the same sort of help with an application. If you want to try it on your own, you can go to healthcare.gov, which is how you get marketplace coverage. But if you have really low income, you might even be eligible for Medicaid, and that's where you would start. If you are low income, you would want to apply for Medicaid first.
Yes.
So in Kentucky, the website for Medicaid enrollment now is kynect.ky.gov.
Yes.
And Kynect has been putting out advertising, or Kentucky has been putting out this information. But if you haven't seen it, Kynect is kynect.ky.gov. So it's a riff on the abbreviation for our state. Right. And if somebody doesn't speak English very well, would you still be able to help them?
Yes, we will. We have access to interpreters, as well as you can call the state number as well and get assistance. But yes, we can still help you even if you don't speak English. If you don't, even for people who don't read well or speak well, we can still help you. We will help you as far as we can.
Awesome. That's really important to know.
Mhm.
So you mentioned that you're not doing in-person meetings. So the best way to get a hold of you would be to call that number, that 859-233-4600.
Yes, ma'am.
All right.
That is the correct number.
So what is different, if anything, about open enrollment this year?
Well, not really a whole lot, but what I will say is that we're glad to have Kynect, like you said, .ky.gov back up. We're known as Kynectors again, which is the initial program that was set forth after the Affordable Care Act was passed. And then after the change of state administration, we went to being referred to as health benefit assisters, and now we're back to being Kynectors. And so the new website is up with kynect.ky.gov. We're excited about that. And it's so much better than it was when it first started, because now you can access all of your benefits and different things that you want to apply for at that one website. So that's a new plus. Basically, we do have 6 MCOs this year instead of 5 that we normally have, so that there's more options to choose from, and a lot of those MCOs have extended benefits that extend from what Medicaid offers, and so additional dental benefits, additional vision benefits. So it's just wonderful if you qualify for Medicaid that you can have those added benefits. So that's a plus this year.
Definitely. And MCOs are the companies that manage your Medicaid.
Exactly.
Yeah.
Mm-hmm.
So that is new information. And I want to point out too about the new Kynect website. It's meant to be more mobile friendly. So if you're primarily accessing it on your phone, it should be easier. And you mentioned how people can apply for other benefits. And I want to point out too that connected with kynect.ky.gov is the Kynect Resources website,
Yes.
which you can search for any kind of services you need in your community. So that is an added kind of resource that's built into the new Kynect.
Yeah, it's kind of like a mall. It's a one-stop shopping.
Right.
Yeah.
And then I think it would be important to talk a little bit about, during the pandemic, Kentucky has made a type of short-term Medicaid available for a lot of people.
Yes.
And I'm thinking about questions people might have about should they be enrolling in this type of short-term Medicaid versus the marketplace, and what's the benefits of either?
Well, I think one of the major benefits is the quick response and the quick coverage that you can have. The governor has extended the Medicaid benefits during this time for basically all Kentuckians. So it's not really based on your income. You just have to do an application, and more than likely then, you qualify, and you will have this presumptive eligibility Medicaid available to you for at least a couple of months, or until they, cut it off. But at least ways you'll have coverage. That gives you a little bit of time to work with in order to get maybe a better plan through the marketplace or what have you. For instance, before open enrollment, it really benefited a lot of people because they were able to get insurance that maybe would have had to wait until open enrollment to get insurance. So they had coverage for a few months, and now they're able to go in and get, either a traditional Medicaid or a plan through the marketplace. But if you're, definitely if you're unemployed, we can definitely, you're probably definitely qualify is what I'm trying to say. But most people, most Kentuckians are qualifying for the presumptive eligibility. And all you need to do is either go online for that to kynect.ky.gov, or you can, get the help of a Kynector. And it's so easy to do the application. They just need very basic information. Yeah.
Right. Thank you for helping to clarify. So it's temporary. You can have it twice in 1 year. So
Yes.
that's between 2 and 6 months of coverage.
Exactly.
But it's quick. And
Yes.
so somebody may benefit from having one in the short term and getting marketplace for the long term.
Exactly.
Right.
And that's what a lot of people have done.
Yeah. Well, let's take a quick break, and then when we come back, we can talk more about what is the marketplace like, what kind of health plans can people find on healthcare.gov, and what are some important things to remember if you are applying and enrolling. So,
Okay,
be right
sounds
back.
great. Okay, thanks.
So, welcome back. You're listening to Kentucky Equal Justice Radio. My name is Miranda, and I'm here with our guest, Jacqueline Ringo from Community Action Council. Welcome back, Jacqueline.
Thank you.
So we were just talking about open enrollment for health coverage, including healthcare.gov and Medicaid.
Yes.
So let's get back into it. What kinds of coverage are available on the marketplace?
Well, you have full service plans, you have dental plans and vision plans, and you have those kind of plans that are also combined to house all of those coverages. So there are multiple insurance companies out there. What's really great about applying on healthcare.gov is that you can also qualify for payment assistance toward your monthly premiums each month, which you can't do usually through, private insurance companies. And so that's a added plus, especially for those persons who do not qualify for Medicaid benefits. They're like, oh no, what am I going to do? I can't afford, health insurance, because they're thinking that, health insurance premiums are, can be kind of expensive. And so that's what they're thinking about. But I've had many applicants to qualify, of course, on healthcare.gov, and then qualify for payment assistance. And it just brings a little extra degree of comfort, and, peace, just to know that, oh, I can have health insurance and it's not going to cost me an arm and a leg, to provide for that. So the payment assistance really helps a lot of people.
Right, and you can also get discounts on the out-of-pocket expenses. So, like the copay that you would pay when you go to the doctor's office, and the
Yes.
deductible.
Yes.
Right, and that is also dependent on your income level.
Exactly.
So, if you already have a marketplace healthcare.gov plan for 2020, what should you renew your application? What kind of things should you keep in mind to make sure that you have the right plan for 2021?
Well, the first and foremost thing is that with any plan is to make sure that you're doing those periodic updates if you have changes in any of your situations, your address, your family size, your income especially. And then those things are updated in the system, which, keeps things up to date. But if you haven't done that, or even if you have and you're considering 2021, then the best thing to do is to get with your a sister or your Kynector and review your application and see what the plans are out there for 2021, because the plans are not always the same for the next year. It may have increased, it may have decreased, or it may no longer exist. And so you may have to go in and look at other plans. Normally, if it's not going to exist the following year, they do send out notifications for that, but perhaps you missed it in the mail or whatever. So it's a good thing to go in during this time and check and make sure everything is up to date and that you have the coverage that you want and need for this new year.
Absolutely. I'll just add a couple of things to that too. Is if you had coverage this year, I think I've heard from some people that they've gotten letters from their insurance company saying, "Oh, your premium is going to be this next year," and sometimes those can be confusing because it looks like it's a lot higher. But if your income stays the same, then your tax credit will go up. At the same time, your premium financial assistance will go up at the same time as your premium goes up. And so you may not actually wind up having to pay any more, even though that initial letter makes it sound like you will.
Exactly. That's a good point, Miranda.
So in those cases, it's important to update your application to make sure that you get the right amount of financial assistance.
Exactly.
And I wanted to say too that it's important to compare the deductibles on the plans, because you don't want to just pick a plan with a low premium.
Exactly.
That if you wind up having to go to the hospital or something, you're going to be paying a lot. So it's important to compare those out-of-pocket expenses when you actually need health care.
Exactly. And that's very important, Miranda. Thanks for bringing that up, that we don't want to just look at, oh, I've got a $10 monthly, premium, but it costs you, like I said, 2 arms and 2 legs in order to go, just for basic services. So we have to look at all those factors, what the deductibles are, what the premiums are, and what the out-of-pocket expense will be. So, and that's another reason why it's good to have a connector, someone to help you understand all these insurance terminologies and all of that, so that it's clear and you really understand what you're getting.
Absolutely. And, you have until December 15th. So that's only 6 weeks total. But at this point, when we're recording, it's about a month. So that time's going to fly by, especially if you're doing anything for the holidays.
Yeah. And then one thing I want to include in that is, people always, we have the deadline of December 15th. And so they all want to wait until December 14th or December 15th to apply. And I really encourage people to do it as soon as you can, because there may be some documents that you may have to retrieve and upload, so you want to get all that in as soon as possible. You don't want to wait till the deadline to do an application, but go ahead and make an appointment with the connector and get it done as soon as possible.
Right. And once you do the application, you're going to want to compare plans and take the time to make sure that your doctor's in network and that the plan is going to cover your doctor. And so it's not just the application at the last minute. You've got to compare plans and make the right decision before December 15th.
Yeah. And you want to have time to make a clear decision. That's true.
Exactly. Okay, so you mentioned documents. What documents are important to have on you when you complete the application so you have all the information ready?
Well, you definitely have to have an ID. If you're doing an application on healthcare.gov, you also have to have an email address. That's very important. Usually you don't know at the onset of an application, but toward the end, you may have to submit documents to prove your U.S. citizenship, which is a birth certificate. They may need proof of your Social Security number, so you may have to upload your Social Security card, just, any of those things, or anything about income, your pay stubs. So it's good to have those, on hand, but you're definitely going to need, your picture ID. You're definitely going to need that, and a working email address as well.
Right. And I've had questions from people so far this open enrollment period, like, well, what income do I count? You count your gross income before taxes are taken out. And do I count interest made on my investments? Yes, you count those. So you count all of your income, and the website or the enrollment system will figure out your eligibility for you.
Exactly.
Okay, so let's see, what other documents? And then if you have, if your employer does offer you employer-sponsored coverage, it's important to have that information so that you can enter that in the application as well, how much your employer-sponsored coverage costs, and if and when you can enroll.
Exactly. That's very important. And a lot of people don't think about that. And but it's very important to get, to get that information. And if you don't already have it, then you'll need time to get that from your employer in order to send that in with the application.
Which is another reason why it's good to start the application sooner rather than later, so you can find
Exactly.
out what else
Yeah,
you might need.
exactly.
So another thing I like to tell people I enroll is to have a list of their medications on hand so that they can compare which health plans cover those medications and their doctors as well.
Yes, and again, that's another reason why you need time, because you need to be able to look at that list, and like you said before, make sure that your providers are covered in the plan that you have. And we can do that when we go into the application. There's links that we can click on to see if your providers are included in that plan.
Right. So if somebody is not documented, doesn't have papers in the United States, can they apply for health insurance through Medicaid or the marketplace?
Yes, they can. There's some other questions that we would need to ask to, to handle that type of situation. But yes, they definitely can. It depends on how long they've been in the country, different things like that. But we can answer all those questions when they call in before we actually do the application.
To that, I'll add that different family members may have different statuses, and so it
Right.
may be that one family member is eligible and another is not
Others.
in those situations.
Mm-hmm.
So it's important that even though an undocumented person may not be eligible for coverage on the marketplace or Medicaid, maybe their children are, so they could still apply for their children
Yes.
without there being an issue.
Right. Right.
And I also wanted to point out here for, we have a pretty diverse audience. And so if you are undocumented and you can't get access to a marketplace or Medicaid plan yourself as an individual, then you may still be able to purchase insurance from a private insurance company.
Yes.
And then if you have an emergency, you can get financial assistance called emergency time limited Medicaid.
Exactly.
And you may have heard the term public charge, which has to do with how you, if you apply to enter the country or to get a green card, they will evaluate, your use of public benefits.
Mm-hmm.
However, emergency Medicaid is not counted in the public charge test when you get a green card, and you can use emergency Medicaid to cover COVID-19 treatment. And so uninsured patients can apply for emergency Medicaid at the hospital or at kynect.ky.gov or with a kynector or at their local DCBS office.
Right.
And the immigration will not consider COVID-19 testing, prevention, or treatment against the public charge test.
Mm-hmm.
So we just have about a minute left. Let's see, what else do you think is really important for people to know about this open enrollment period?
I think the most important thing is that if you do not have health insurance, that you apply for health insurance, regardless of, whatever your financial situation is, your family size, what have you. There are so many options this year. So get covered, I think, is the most important thing, is get covered, whether it's the presumptive eligibility, whether it's Medicaid, whether it's a plan on healthcare.gov, or even if you qualify for Medicare. And, if you need assistance, if you need referrals, then, we're here to help you do just that, get you that information. I think getting covered is the most important thing.
Agreed, yes. And if you're not sure about which coverage is best for you, that's what Kynectors are for.
Exactly.
So that website again is Kynect, KYNECT, .ky.gov.
Yes.
And the general phone number, if you have general questions about Kynect in Kentucky, that's 855-459-6328. Again, it's 855-459-6328, and they can refer you to a Kynector or point you to healthcare.gov or whatever it is you need. And then in the Lexington area, Jacqueline, can you give that number again for community action?
Community action is 859-233-4600. And you can ask for a Kynector in your county, or you can ask for me, Jacqueline Ringo, and I can refer you if you're not in Fayette County. We do have coverage in Fayette, Bourbon, Harrison, and Nicholas counties. We'd love to help you.
Awesome. And we mentioned too, if you have Medicaid and need to just change from one Medicaid company to another, a Kynector could help you do that. But there's also the member services number for Medicaid in Kentucky, which is 1-800-635-2570.
Exactly.
All right. Well, I think we've pretty much covered it, and I hope that people call you for help.
I hope so. Please call us.
All right. Well, thank you so much, Jacqueline, for being on with me.
Me, Miranda. Thanks for having me.